we get some decent odds. And as I always say, how good is jumps racing? Well, despite an enormous amount of goodwill from both sides of politics, the reality is that the NDIS has become overrun with cost blowouts, wastage and, unfortunately, rorts. At its core, the scheme has the noblest of intentions, but when you start hearing about cowboy NDIS providers overcharging up to 1,000% on goods, and things such as sex workers being parts of plans, as with any government program, you have to seriously ask, how is this money being used? Now, Labor's been talking a big game on reining in the NDIS, with the Minister Bill Shorten saying Labor can achieve a massive $15.3 billion saving through less frequent plan reviews, better value for money from services and equipment, and cutting out the middleman and dealing directly with service providers. Joining me now is Liberal Senator Hollie Hughes, who's been a long-time advocate for getting this scheme right. Hollie, welcome. I mean, Shorten's talking a big game here, as I just said, halving the growth of the scheme by 2026, $74 billion in savings over a decade. But we know how big this scheme is. Can it actually be done?
Look, I actually think it can be done, but I think what's frightening at the moment for a lot of NDIS participants, and my son is one, so I have a lot of personal experience with this, as well as being the Deputy Chair of the Joint Standing Committee into the NDIS, that there's a whole lot of areas that just aren't being looked at, and there's not a lot of detail coming out, and that's really frightening for those participants and their families. So if Labor's serious about this without frightening the community of disabled Australians and their families, they need to be more upfront with what they're planning. Over the past 4 years since I've been on the committee, we've done a number of reviews of the scheme, and these generally are bipartisan. So when you see the Joint Standing Committee NDIS reports, very, very rarely is there a dissenting report. Normally these are something that the committee all agrees to and works on together. And some of the suggestions that we've made, it does look like hopefully they're finally going to be picked up. So one of the problems is if you've got a child with autism or you're someone with cerebral palsy, you get a planner from the NDIS who may never have had anything to do with your disability or disability type. So their ability to effectively assist you through the planning process is negligible. Like, it's just ridiculous. So we've been calling for a long time that there are disability-specific planners so that you can actually work together to get the best out of the scheme. Another example of that is I've been working with the deaf community. And when children are diagnosed as being deaf, and quite often this is found out when they're tiny babies in hospital with the Swift test that's taken place. So there's a lot of early intervention that can happen, you know, in the first few days of these children's lives. Yet the NDIS planners that they're put in touch with have absolutely no idea where to direct them, no idea where to send them, and they're given this kind of like plan to start with that quite often the money's wasted because the parents are still trying to navigate a system. So we do need to provide more in the sense of guidance where people should be getting this best practice therapy, particularly in early intervention. But the service providers, one of the things that we've also recommended, and I've had many a go about this on the autism inquiry, the NDIS inquiry, is there's a thing called the price guide. And if I was in charge, the first thing I'd do is get rid of the price guide. Because if you are Caleb or Hollie and go into a physio or a speech therapist or audiologist or anyone, we get charged a rate. If you go in as a healthcare card holder, as a veteran, you might get charged another rate.
Yes.
If you go in as an NDIS participant, you get charged at the highest rate.
Of course.
Now, this is absolutely ridiculous. And companies, whilst it's rorting the system in some, or it's maximising the system, they're not doing anything incorrect because the NDIS is the one setting the price point. So if you can get a speech therapy session for $100, but the NDIS rate is $195, what would you charge as a company?
I know. And I've heard stories. I've got friends who've got a waste management company in Warrnambool, and they get people calling up wanting to get rid of medical waste and that kind of thing, and they've got a budget under the NDIS to do it. And they basically say, tell us how much money you want, and they charge them the normal rate, but there are plenty of people who aren't. They're taking the service and us, the taxpayers, for a ride. And Labor now says they want
taxpayer-funded system. Any taxpayer-funded system, if a company or a provider can look at it and say, how much can I charge? And unfortunately, there seems to be a bit of an attitude across the country, across the electorate, that it's government money. It's not government money, it's taxpayers' money. So when someone is sort of, you're robbing Peter and Peter's paid.
Yeah,
because, at the end of the day, everyone's paying that increased tax rate to keep it going. The NDIS, and look, I could not say this more strongly, the importance of its sustainability is critical for families that are on it, but the NDIS, most importantly, is for all of us. And this message gets lost. Because, Caleb, you and I don't know if something happened through the birth of a child, a car accident, anything. Any one of us could find ourselves requiring the NDIS as a support. So this isn't something that just affects a niche community. It is there for all of us. The biggest problem in it, though, and this was under Gillard with Macklin and Shorten, that they basically gave the states a free pass. They said, as the costs increase, we will pick them up, you will not. And what happened, and I can tell you from personal experience, having a son with a disability, the state governments in every state vacated the field. The education departments deserve a special mention for their neglect of what they're required to provide to students with, and particularly if you think about it, developmental delays, things that these kids are going to catch up from, that they're not lifelong and permanent disabilities, which is what the NDIS is for. But rather than these kids getting a bit of extra reading support, math support, bit of aid in the classroom, they're basically being told, you've got to go get an NDIS plan because that's who looks after everything. And so the states have to step back up in a big way. But the lack of detail from government scares participants. Sorry, Caleb.
Sorry, we're running out of time here, Hollie. But before we go, of course, last night we had the budget reply speech. Do you feel confident that the opposition has put up, not just a series of motherhood statements, but a genuine plan that would deliver more money to people's pockets, particularly when it comes to things like tax, especially when we see today that middle income earners, even with stage 3 tax cuts, will be worse off by 2025?
Yeah, well, we saw the low and middle income tax offset go. So most middle Australians are $1,500 worse off straight away. End of story. They're $1,500 worse off. They're actually not included in the $500 possible energy rebate or whatever the payment's going to be. And it's maximum $500. Depending on what state you're in, it could be significantly less. But that won't come to you if you are a working Australian. So what we offered last night and what we talked about last night was we would have extended the Lamito, so that $1,500 wouldn't have come off. We would not have demonised gas, so you wouldn't see supply issues and what's happening in the gas market at the moment. So prices are continuing to increase because that's how we could keep them under control. We had good relationships. Angus Taylor had good relationships with the gas companies. We've also committed to allowing people to still access their super to buy their home. That is the most secure thing you can do for someone to provide safety in their future, that they own their own home. The other things that Mr Dutton mentioned last night, and I think this is critically important, we have 438,000 job vacancies across this country at the moment, and we need to get people into them. You walk into any store, anywhere, any restaurant, anywhere, they are crying out for staff. And Mr Dutton last night proposed allowing those on job seeker rates being able to earn double before their benefits were, had any effect on them. What I think we need to be doing is looking, how do we get these people off welfare into work? There is no excuse. There is so much work available at every different level of skill that we need to be providing incentives, training, assistance, whatever needs to happen to actually get these people into work and off to welfare.
Yeah. And stop the entrenchment. That's, there are people who are entrenched in welfare and we need to get them off. Hollie, I'm sorry, we've run out of time.
The budget on Tuesday did nothing but entrench welfare in this country.
I totally agree. I'm sorry we've run out of time, but Hollie Hughes, thank you for joining me tonight.